Preventative healthcare can help detect life-threatening illnesses such as cancer, diabetes, high or low blood pressure, and also prevent diseases through vaccination. In the field of men's health, some important preventative healthcare measures include prostate cancer screenings, yearly physicals, and funding. Promoting healthy lifestyles through public health campaigns is also another effective way to implement preventative healthcare. Men's Health Network, Healthy People 2030, and the recognition of Men's Health Awareness Month are all organizations and movements that help spread awareness to this cause. The Affordable Care Act was signed into law in 2010 to make preventative health care more affordable and accessible. The ACA requires health plans to cover recommended preventative health care without deductibles, co-payments, or co-insurance. The Affordable Care Act is also responsible for the creation of the Prevention and Public Health Block Grant Program. The PPHF is a program that provides national funds for public health and prevention policies. The Consolidated Appropriations Act of 2022 was approved by both the House and the Senate and signed into law by Joe Biden. This law gives $110 million for the prostate cancer research program at the Department of Defense, $14.2 million for prostate cancer prevention at the CDC, and $44.6 billion for the National Institute of Health. By providing funding for organizations to research and build ways to prevent prostate cancer, this act is a huge step forward in expanding access to preventative health care for men. Having funds to do more research will help agencies like the CDC and the Department of Defense develop other policies to aim to improve access to health care. According to the United States Sentencing Commission, 88% of the people in federal prisons were sentenced in the past 10 years. Of those sentenced, 93% of them are men. In the 8th Amendment of the Constitution, it states that prisoners have the right to adequate health care. Despite this, prisoner health care and the justice system as a whole needs lots of reform. Re-entry programs are a common way that organizations and government agencies assist people who were recently released from incarceration. The CDC provides an extensive list of programs of physical and mental health resources for people who have been released from prison. The Council of State Governments provides a checklist for correctional facilities to follow when they are releasing someone, which includes checking if they have a substance abuse disorder, experiencing alcohol withdrawals, or if they have access to medical coverage upon release. The United States Department of Justice, Health Resources and Service Administration, and the Centers for Medicaid and Medicare all provide federal resources for preventative health care access to disadvantaged people being released from prison. The Veteran Affairs Mission Act became a law in 2018 and aims to expand healthcare access for veterans. It expanded telehealth and urgent care access to give veterans more options in their healthcare. Veterans will be able to work with their VA healthcare provider and see if they are eligible for community care. To select care within their community, a veteran must meet any of the following: need a service not available at any VA medical facility, lives in a U.S. state or territory without a full-service VA medical center, qualifies under the grandfather provision, or the community care provider by the VA must be upheld to certain standards. The VA department has other preventative health programs as well. This includes MOVE, or MOVE, which helps veterans learn how to better manage their weight and reduces risks of chronic disease, gives them access to clinical prevention services that provide veterans with health screening recommendations and immunizations, and health promotion programs that advocate for healthy living and chronic disease prevention. Public health campaigns are great ways for organizations to spread information and resources about preventative health screenings, disease awareness, and other ways to stay healthy. Healthy People 2030 emphasizes the gender lifespan gap and how men are at a much higher risk for serious conditions such as heart disease, lung cancer, and HIV. They also spread awareness about male-specific health concerns like prostate cancer. Healthy People 2030 sets national goals to reduce the amount of men that are impacted by these health concerns. They conduct research which is used to guide the development of evidence-based policies to improve the well-being of all people. Men's Health Network partners with government agencies, religious institutions, healthcare providers, and other private entities to help men gain access to free screenings and educational resources. MHN acknowledges health disparities in different ethnic groups and accommodates their educational resources to fit the needs of all. Being inclusive in health education is important because it will reach and impact more people. Workplace wellness programs are implemented by some companies to promote healthy living for their employees. This includes weight management programs, regularly checking in with their employees, providing health insurance, and health policies to ensure the safety of workers. Research has been conducted about the success of workplace wellness programs, and the results do vary. The success of workplace wellness programs can fluctuate depending on the company and the way they implement their programs. Even though the success of the programs cannot be fully measured, starting conversations about healthy lifestyles and disease prevention at the workplace is still beneficial. These programs provide large and diverse groups of people with health education and events where they can feel supported through their health concerns. Preventative health for men is a topic that should be addressed more frequently. Through public policy, new initiatives can be implemented in order to give people more access to preventative care. Prostate cancer, HIV, lung cancer, and heart disease have large impacts on the health of men nationwide. Policies like the Affordable Care Act, VA Mission Act, and the Consolidated Appropriations Act, and others are all examples of public. During this video, I hope you learned more about government actions surrounding preventative care and also about organizations to support if this is also a topic you care about.